Welcome back, everyone. Thank you very much for staying with us. Tonight, we shift our attention to health matters as the world marks the 2025 World Cancer Day on the 4th of February. Health experts have called for increased funding to combat cancer, warning that inadequate resources are hindering progress in the fight against the disease. And for the National Institute for Cancer Research and Treatment, the institute has since launched the National Strategic Cancer Control Plan and is working with several partners to implement its activities in cancer prevention, diagnosis, treatment, and palliative care, as well as data management and advocacy. But before we get into a conversation for tonight, let's share this report by TVC News senior correspondent Kemi Balogun.
This year's theme is United by Unique, which emphasizes a people-centered approach to cancer care by placing individuals and their stories at the heart of the conversation. Gloria was diagnosed with cancer in 2010. She entered into remission but relapsed in 2018. She is now cancer-free and became an advocate in 2017 to bring hope and support to many women like her who are going through or have gone through the harrowing challenges that follow a cancer diagnosis.
I had a very strong family support. I wasn't married then, but my family was there for me. When I was diagnosed, I refused to live in denial. I only sought for second opinion, and when it was confirmed, I was like, okay, God, you have decided that this thing was going to happen. I am now here. I'm going to go through it, but come with me.
Gloria says stigma still plays a key role in the cancer burden, and although there has been a lot of improvement in the cancer response in Nigeria, cancer patients still face several challenges.
As of 2017, when you go to the hospital and you cannot pay out of pocket, then you are done for. You just go home. But as we speak, the National Health Insurance Scheme has co-opted some parts of cancer treatments into as part of what they cover, into their coverage. So they cover surgery, they cover some drugs, they cover consultancy, they cover diagnostics, which is still huge. But there are some drugs they don't cover, especially some chemo drugs.
In Nigeria, there were over 127,000 new cancer cases and 79,000 deaths in 2022. Many initiatives have been put in motion by the government to tackle the cancer scourge inwardly. One out of this is the Cancer Health Fund. The CHF is an initiative of the Federal Ministry of Health and Social Welfare aimed at providing cancer treatment to indigent Nigerians and strengthening national cancer care. This year, experts believe that while cancer affects millions globally, each person's experience is unique and personalized care is essential.
So let's talk about Nigeria's cancer advocacy and the deliverables. Dr. Zainab Shinkafi Bagudu, President-elect Union for International Cancer Control. She's also founder and CEO of Medicaid Cancer Foundation, is on the program with me tonight. Dr. Zainab Shinkafi Bagudu is a member of the Nigerian Cancer Society and the African Society for Clinical Oncology. She has dedicated over 15 years to advancing cancer awareness and support, particularly focusing on its impact on women and children. Good evening to you, Dr. Shinkafi. Thank you very much for joining us on the program.
Thank you for inviting me. Good evening, Jumoke.
Right, so let's start with the theme of this year, which is United by Unique. A reminder that every cancer journey matters and that collective action is key to ensuring compassionate, equitable care for all. What do we make of every 4th of February, and what is it about this year's theme?
Well, the 4th of February has been designated World Cancer Day it was an initiative of the Union for International Cancer Control and the WHO, and all the countries signed up to it. And gradually over the years, it's been building up so much momentum, and nobody really knows where it came from. But the UICC is tasked with deciding the theme, and every 3 years a new theme is picked. This new theme is the first in the 3 years, and it's United by Unique, as you rightly said. It means that each person is unique. Well, it can mean so many things to different people, okay. But the message is that we're trying to put people at the center of cancer, personalized care, and including the person, thinking of the person as opposed to cancer as a disease. Everybody is unique, even without cancer. But to come together to beat that cancer, then we have to unite. So in a nutshell, that's what the theme is about. And it's been very widely accepted over the last 1 week, I'd even say, before the actual 4th of February. There's been a lot of traction and it shows acceptance by people. We just saw Gloria, a cancer champion, a survivor, and these are the kind of people that we want to focus on their stories so that other people will be more encouraged if they have cancer and know that it's something that you can beat, really.
So if the theme of this year, as I've explained, is about understanding the patients before the cancer, what would be the impact of this on the patient? And do we have what it takes to make this shift as a nation?
Well, as for us in Nigeria, yes, we appreciate the fact that there are lots of barriers in cancer awareness, in cancer screening, in cancer treatment, and even palliative care for end of life. We, however, believe that we can see that there are a lot of tangible steps that are being taken to improve the situation, such that the people that have cancer themselves, again, I go back to Gloria, are testifying to the fact that there are improvements from when they were diagnosed to now. We've seen so many new cancer centers come up. Yes, some have gone down, but then new ones have come up. A few weeks ago, the coordinating minister of health announced that there would be the start of more cancer centers in, I think it's about 4 geopolitical zones of the country. There's been gradually increased budgetary allocation to cancer care. We now have a cancer health fund and so many other things that are encouraging and make us know that, or the government at least is doing something progressively. Cancer is the greatest disease that causes financial toxicity in our communities. It is the biggest contributor to financial toxicity. So we have to understand that it's going to take some time, but eventually, with all the advocacy that we're doing, working with the communities, working with all the stakeholders, financial bodies, and really fixing our health system, then we will see a better future for cancer patients.
So let's look at the numbers, especially where we are as a nation. According to a 2022 International Agency for Research on Cancer, the number of new cancer cases in Nigeria is estimated at nearly 128,000 per year. What is the current statistics as relating to new cancer cases in the country?
Well, that is the current statistics, over 120,000. 120, yes.
128,000.
Yes, but if you think that is high, then it's really underreported. Because if you look at a country like Brazil with the population that is maybe similar to Nigeria and with similar socioeconomic background, you will find that Brazil reports 400,000. So where are the rest of our cancer patients? It's underreporting. The cancer registries are not strong enough to go into the communities and all the hospitals around to collate that data. And then even the diagnosis itself, it's poor. We've heard about there's so much stigma that is associated with cancer. Patients in our rural communities do not admit they have a problem, whether it's cancer or anything, until it is reached the advanced stages. So this makes it quite difficult for our data to be accurate. And again, this is another place where the National Institute for Cancer Research and Treatment has been putting more effort of late, cleaning up the data, strengthening the cancer registries, empowering the human capacity, the resources, the computer systems that exist that help us to register the number of cancer patients, the type. It's not just how many, but what type. This 127, the commonest is female. Females have more, and that is breast. So we need to be able to extrapolate what is going on in our community so that we can respond appropriately with the right treatment and care modalities.
But really, what would you say is responsible for the increase in the number of cases and deaths?
Well, it's better reporting. we're still not where we need to be. If you look at the numbers that the United States reports, is much, much higher than that. At the same time, the survival is also much higher. So we need to have, there are so many reasons why it's increasing. The increase in numbers that are being recorded, as well as lifestyle factors like sedentary lifestyles, smoking, alcohol, and exposure to causative viruses like the human papilloma virus that causes cervical as well as other types of cancer, anal, mouth, and so on. So these are all things. Lifestyle plays a key role. The type of food that we're eating is more and more processed. We're steering away from our natural foods into processed and foods that have additives and chemicals added to them. All these things are not helping, and it's causing a direct increase in the cases of cancer that we're seeing, which is why we tend to advocate a lot for prevention. It's the easiest thing that we can do as Africans, as Nigerians. If we improve our lifestyle, or we even maintain our traditional lifestyles, then we're likely to have less cases of cancer, or we will see an improvement. But it's very difficult. There's so much modernization going around.
Well, but at a press conference recently, Nigeria's Minister of State for Health and Social Welfare, Dr. Isiaka Adekunle Salako, said the federal government has made substantial investments in cancer prevention care within the last 18 months, ranging from primary prevention through vaccination, early detection, prompt treatment and research. You're a major voice in the cancer awareness community. Is all well as far as cancer treatment in Nigeria is concerned? Where are we now?
We're not where we need to be, but we're moving. We're moving slowly. We'd like to see more movement. There's been a lot of talk in the news about the withdrawal of support by the new administration of the US for healthcare, in particular cancer care. The National Cancer Research Institute is not being funded anymore. And these are all bodies that support cancer research and other advancements in LMICs like Nigeria. But it is making us look towards other places where we can find better solutions. It's making us partner with other world powers, and the funding is being increased, like I said, incrementally.
But Dr. Shikafi, is it high time we looked inward and see what we can also do for ourselves?
Yes, that's the point I'm making. And, we should look at the recent events in world politics as an opportunity for us to look at other aspects, both inwards and outwards, to provide these things for ourselves and make us more resilient, less dependent on donor aid. We've heard so much about all the new funding that is coming towards healthcare, particularly cancer care. And we need to make sure that since we now have good political will, as citizens ourselves, we need to work more on I call it citizens' will. It's not enough for government to provide the funding, but we also should try to, do better in our own daily lives.
That's you talking about lifestyle choices. But, let's go back to the theme of the year.
And work ethics. Work ethics, very important.
Absolutely. So let's go back to the theme of the year, United by Unique, which, with everything you said tonight, highlights the value of individuals' patient-centered care. This approach, represents a fundamental shift in how health and cancer services are designed and delivered, placing individuals, families, and communities at the heart of health system. In the fight against cancer, this means no two breast cancers are the same. So what should be our own plan in making sure that this becomes our approach as a nation in terms of treatment?
Well, it's a personalized theme, and it's important, or we should think about it, how we can get it to our primary healthcare system. Right now, we don't provide screening or much cancer care in our primary health care system.
When you say, Dr. Shinkafi Kanihoda, when you say it's a personalized theme, is that on the part of the patients now?
The theme, no, on
Okay.
the path of the campaign.
Okay.
So cancer, there's no two cancers that are the same. You have
Absolutely
rightly said. There are a lot of factors that come into play, the genomics, the place that you are, even the responses and how early it's diagnosed and so on. So it's very difficult to say that these two cancers are the same beyond it's affecting the same organ. We cannot predict how this person is going to react to this drug and, radiotherapy. But if we offer the basics and we do each step of the way, for instance, screening, if we offer that screening and we know that every woman, we know that there are certain facts that we know at the ages of 35 and above, 40, every woman should have a mammogram at least every 2 years. Sexually active women should have an HPV testing at least once in their lifetimes. There are cancers that can be eliminated totally. Cervical cancer is the flagship of that. And for that, we need to screen, we need to vaccinate. Last year, one of the big progress that we had that I haven't mentioned is that Nigeria has been able to roll out the HPV vaccine. And in that regard, we're now ranking almost 17 million girls have been vaccinated against HPV, which is the causative virus for cervical cancer. So these are all things that are individualized in a way, but lie within the realms of the responsibility of the national government. Individualized in that, I'm sure a lot of people will tell you that, oh, I'm not going to give my child the HPV vaccine because it causes this, it causes that. But at the same time, I can tell you that 17 million Nigerian girls have had the vaccine. So, and they have a future that is going to be free of cervical cancer. They are 90% likely not to have cervical cancer.
All right, Dr. Shinkafi, because this is a forward-thinking approach, and I can imagine how tough this is already, especially with the data we have, I do recommendation of one clinical oncologist to cover between 250 to 500 cancer patients. But here in Nigeria, we're yet to reach that milestone. We're still struggling, especially with the latest report from the NCS. The president of the Nigeria Cancer Society has just revealed that Nigeria is facing a severe shortage of clinical oncologists, with less than 80 specialists left in the country. What does this mean in a layman language? What crisis does this portend?
It's not good. It's really not good. We have way below what we're supposed to have. Sometime last 2 years ago, we used to say 120, but it's dropping. Why? Because these people are skilled, they're highly sought after. And it's not just about the clinical oncologist, it's about the biomedical engineer that is going to fix the screening machines I'm talking about. It's about the medical physicist that measures the amount of radiation that is going to be delivered to a cancer patient. It's about the oncology nursing. There's so many healthcare professionals that are involved along the line of cancer care and other things as well, like the kind of medication that we produce locally. What taxes are the pharmaceutical companies facing? Can they repatriate their money, and so on and so forth? But we've seen a lot of loss of health professionals and other professionals from Africa and other LMICs to high-income countries. And that's a really big topic, but we're seeing some attention being given to it. Absolutely not enough. It doesn't say well for us. We have to find ways of drawing back our diaspora skills. We have to provide better conditions, social welfare. And at the same time, I always say this, but people think I'm just being sentimental. I think the Western countries also have a moral responsibility to enter into training agreements without necessarily keeping our professionals in their systems, because yes, it's financial. We're never going to be able to compete with them in that regard, not for a long time. So are we all going to just, everybody goes abroad and that's the end? Our relatives back home will die. Almost every medical student you meet today, their plan is to go abroad.
Absolutely.
They're not even thinking about, which university am I going to specialize? Only if they don't get the opportunity in terms of visa or something else, but they're gone. and it's made so easy for them, and that's not right. Yes,
and when you ask them, Dr. Shinkafi, they say there are not enough centers here in Nigeria.
No, that's not true. We can cope. In fact, what some countries are doing is what is our biggest resource in Nigeria? It's not oil, it's our numbers, it's our people.
Yeah.
We are such a huge country. Imagine if we sit down and decide to actively churn out medics and exports to the world. There are countries that are doing that now. India will not admit non-Indians to study some courses like medicine, because there's a 10-year plan to churn out these professionals and export them to the world. You want professionals? Here they are. We need to look at things like that in our national plan.
I understand you, Dr. Zainab Shinkafi Bagudu, but let's take a break, and when we come back, we'll talk about advocacy. Just stay with us, everyone.
Thank you.
Every major news story is with many perspectives and layered with different levels of impact.
Hello. What time did this happen?
TVC News, first with breaking news.
Welcome back to Politics Tonight, everyone. This evening, our attention is focused on Nigeria's cancer advocacy and the deliverables, and I've been speaking with Dr. Zainab Shinkafi Bagudu, President-elect, Union for International Cancer Control. She's also founder, CEO of Medicaid Cancer Foundation. Thank you so much for staying with us, Dr. Zainab. Let's talk about advocacy. In the last 10 years, have we made any progress when it comes to national cancer control programs? Have we made progress towards expanding care for millions of people? Is government really working towards strengthening institutional response, increasing resource allocation, and building its oncology workforce and services to tackle its cancer burden?
There are two parts to that answer. It's yes and no. Yes, in that, yes, there's been a steady increase. If you look at the numbers, they're higher. Is it enough? No. Cancer is very complex, very expensive, so we're constantly playing catch up. By the time they are allocating, certain amounts, or the NHIA is covering cancer diagnosis, there's a new therapy out that cannot be funded. The Cancer Health Fund we're talking about, I'm not sure how much has been appropriated this year, but last year it was something like 200 million. 200 million is not going to do much. So we need to see real money thrown at treatment of patients, real money thrown at the building of the infrastructure and provision of the equipment that we need for cancer care, and real attention and focus given to developing the human capacity that is going to man these centers. So it's not something that, again, to borrow an example, in Egypt, they have a presidential initiative for women's cancers, and Egypt is a high population country as well. The numbers they're giving out now is amazing because it had that political will and the funding thrown at it and the will of the professionals to do the work. So it's a whole combination of things.
All right, so let's talk about the challenges. Let's talk about the challenges. You're a specialist, and some experts have cited the lack of adequate healthcare infrastructure. You have talked about inadequate funding, and also some have talked about the shortage of specialized healthcare professionals as reasons why Nigeria is not winning this war against cancer. Let's focus on the issue of healthcare infrastructure. Is it really bad?
Yes, it's bad. The primary healthcare system, the general hospitals, I think primary care is even better. We're always talking about it. They have supervision. There's an agency that overlooks them. But the general hospitals, that is where the crux of the matter is, and that's the secondary care. We're always looking at maternal health, women's health, immunizations and things like that being delivered at the primary health care. The tertiary are not bad. They get funded and they are run by professionals, very specialized people. But in the middle, in the states, is where there needs to be more attention. Health infrastructure is poor, and it can be much better than what we have now for our people.
So let me also ask you, I think this is a yes or no answer. Do we have a dedicated national plan for cancer control?
Yes, we do. Yes, we do. Again, is it adequately funded? No. We have a national cancer control plan that is running from 2023 to 2027. We have a national cervical cancer control plan as well, but all not funded. Well, especially the cervical cancer one, not funded. There's no funding appropriated for it.
But can we really have enough funding for the healthcare sector?
Well, we don't, but we've seen a huge increase in recent times. For the first time, I think we got up to double digit, 10%, near the 15% of the Abuja Declaration recommendation for health. Last year, we saw 10%. I don't know what it is this year, but we're getting...
All right, well, we'll get to that in a moment. But for Nigerians with cancer, particularly those in rural areas who seek medical attention at advanced stages of the disease, making treatment more challenging and expensive for them. How much attention are we paying to those set of people? Are we doing enough when it comes to advocacy to most of these rural areas?
Okay, so you mentioned that we were speaking about health infrastructure, funding, and so on. What you have mentioned is the biggest challenge in cancer, the awareness and the knowledge, and it has the majority, the highest number of patients, because the majority of Nigerians are those in the rural areas. Out of, all those 127, if they were really, if that was really the number, yes, 127,000, I can assure you that 80,000 would be from a rural area. But they do not have the knowledge and their health-seeking behavior is poor. They will first go to a traditional, and this is standard. It doesn't matter whether you are in, Sokoto, Enugu, or Lagos. It's the same. Lagos might be a bit more cosmopolitan, but it's the same thing intrinsically. They will first go to a traditional or religious faith-based healer and then seek help when it is in a more advanced stage, and this makes it really difficult to treat. The reasons why all the other advanced countries have been able to overcome it is, yes, they have strong health systems, but at the slightest sign of a problem, the majority seek help. It's a, catch-22 situation. You will seek help if you know that you're going to a place where you can be helped. If that place exists, if there's a social welfare system that gives you the transportation to go there, that will pay for it. Many people, the NHS, for instance, in the UK, is a very strong health system. People, yes, there's lots of complaints, but you walk into a hospital and you get treated. There might be a delay, but you have cancer, you get the latest cutting-edge gamma knife, targeted therapy. Most of it is available on the NHS. Every day we read of a new one. So our rural population, they don't have that incentive to go to hospitals because they don't have the treatment. So they can't afford it either. They go to the traditional healers, the cancer advances, and by the time somebody takes them to the general hospital, there's not much that can be done.
So
every day.
Dr. Zainab, that's on the people. And I asked the question because there was a report carried out by the International Atomic Energy Agency in collaboration with the World Health Organization and the International Agency for Research on Cancer. These groups evaluated the current health system and strategy of Nigeria. That report observed that the distribution of health services in the country is uneven. Major health centers are concentrated around larger cities, which sometimes are not easily accessible for many Nigerians outside urban centers. So how can this be addressed?
Again, it's national planning and looking towards the primary health system and how we can strengthen those systems to provide those clinics to provide better care. There are some that will do some reasonable cancer care, but it's not enough. Then we can also have private sector, corporate bodies. There's a scheme whereby they can adopt a primary health system, but I try to have a primary health care center and I'm not allowed. So why? If yes, you have to be under one state government or something. So there are people that, I want to give back to my community and place a primary health care center, run it, fund it, and do what I need to do. Not necessarily offering that high-end cancer care, but basic maternal care, clean, and show them how it should be done and things like that. But our law doesn't allow us. So the people as well, yes, I agree with you. There's a lot, but it's everybody has to do their own part. We have to educate better. We were talking about advocacy. There are more civil societies in terms of awareness, knowledge, and community engagement. There are more civil society organizations now that are doing that. There's no state in Nigeria that you will go that does not have a branch of the Nigerian Cancer Society. And there are so many organizations, other CSOs, NGOs that are under that Cancer Society, and they're all reaching out to their communities. They're working with the community gatekeepers about cancer awareness and so on. It's just quite a difficult task, and there are other aspects. How much education does that community have? How do they go to school? Do they receive their childhood vaccinations? Do they go to the healthcare center for prenatal care and deliver? These are all things that will affect their health-seeking behavior and make it a bit more difficult for the civil society to impact their care.
But in this era of fake news, fake information, how do we fight misinformation about cancer diagnosis and treatment? I want you to address this because, I know that in cancer, misinformation spans the cancer control continuum and can affect cancer prevention, talk about screening, diagnosis, treatment, and even survivorship. Please address this. Are we managing this well?
Well, it's a huge task, and it's something that everybody has to play a role in. I just before I came on here, I belong to a WhatsApp group with healthcare professionals. It's called Friends of Health in Nigeria. And somebody on that group, I must find out who it is, just posted one of these misinformation videos about certain, I don't want to mention the name so you and I don't get sued, doing vaccines to do with the tetanus vaccine and was banned from Kenya. So I asked a question, I believe it's a she. I asked, so can you explain what your point is? My point is that you'll be shocked at how deep this misinformation
absolutely, and that's why I'm asking you this question.
Even within the healthcare circle. So we focus on the Mama Binta in the village and try to tell her, no, it's not like that. But what about the nurse Binta? She's there telling them about, don't give your girls this and so on. So we have to train our healthcare workers better. The media has a huge role to play, particularly radio. Our people listen to the radio a lot. It was radio that was used to try to destabilize some of the information around the HPV vaccine. So why don't we use it better? We have all these tools. Information is key. Have foot soldiers that are going everywhere and working with the community.
Dr. Zainab, you're a specialist, and I guess that's why you're very concerned. So what level of investment should go into that? Do you think government is really paying attention to it?
Not as much as it should, because there are so many conflicting priorities when you're in that government seat. It's easy for us to say this and that, but when you're there, you have to think about security. You want to buy guns for the army. You want to build a road. Put aside even the health sector, the universities, the education. You start from primary school, secondary school, universities, all on government. So conflicting priorities, we agree. But at the same time, there are some urgent things that there are other bits that we as individuals can do. I spoke about the civil societies, the NGOs. Our youth are very active, very, very proactive and passionate Nigerian youth. So they do a lot of that, and they know how to seek for all these grants that will help them. But at the same time, the environment can be more conducive. We can guide them, which is one of the things the UICC is good at, working on fellowships to build capacity for civil society, NGOs across the world, so that they can do that grassroots advocacy better. We have resources like our traditional rulers, like this same faith-based healers, the same our pastors and imams. We should engage them more. There are a few that do, but not enough. If we were to have all of them on our side, then, our people listen to them a lot. Another, sports is a unifier in Nigeria. Let's use sports to send our health messages. There are lots of things. I'm not saying all these things are not being done, but Nigeria is big. It's a big country, and for it to really get to every nook and corner is not one government's job. We all
Perhaps
have
I
to
should, read out some of these misleading ideas, because if experts say research advances have improved cancer treatments to make it more effective and to reduce side effects, yet some misleading ideas about cancer treatment still persist. One of which is that regular checkups and today's medical technology can detect all cancer early. Is this true?
I don't know about all, but a lot of cancers, there are biomarkers. You can just have a blood test that it won't tell you which cancer, but it will tell you that there are some things flying around in the blood that indicates that a certain cancer is going to come later. Genetics plays a huge role in cancer. And unfortunately, the research that is being done on the African continent and Nigeria in particular is really low. Less than 1% of the research in cancer is done on Africans. So if we're not learning about how Africans respond or how they behave, how their bodies respond to cancer, how are we going to have the right targeted treatment? These targeted treatments are looking at attacking the genes, and they're working at that level. So we don't even know what our genomes and how they react to the cancer is like. So these are all maybe a bit more advanced, but it's happening. But cancer can be screened for. Most cancers can be screened for. There are some that don't have screening tests, but then again, regular checkup generally will show most things. By the time you do a blood test, you do a scan here, an x-ray there, if there's something wrong, the health professionals will pick it up.
All right. So another myth is that undergoing cancer treatments means you can't live at home, work, or go about your usual activities. How correct is this?
It depends on the stage of the cancer. The people that say this, or the myths, it might be a late stage. You can live at home. People go for day cases. They go into hospital. There's so many hospitals that offer. In fact, I don't think anybody keeps anyone in hospital for chemotherapy anymore, except if the condition is bad. But they walk in, they have their chemo, they go home. If they develop complications, they go back. Patients on chemotherapy do emit small amounts of toxins, but it doesn't mean that they cannot, because it's a toxin that you're giving to them. It doesn't mean that they can't live at home. We live with them all the time and nothing goes wrong. But depending on the stage of the disease, if it's bad, then things will go wrong.
So I have a lot here, but let me take this final one. A needle biopsy can disturb cancer cells, causing them to travel to other parts of the body. How true is this?
Yes, it's true, which is why before the biopsy is done, it's advised to do a scan first. If it's an obvious mass, many surgeons won't even touch it without a full MRI, so that they can try to define the margins of the cancer. And it's always better to take it out completely. So once they've done all the tests, imaging tests with dyes or no dyes, then they can take it out. But there are needle biopsies. There are masses that you just, pop a needle biopsy. It has its place, but one should know when you shouldn't do it, and then do the full excision biopsy so that the full picture can be obtained.
All right. So hepatitis B birth dose for liver cancer and HPV vaccines for cervical cancer. We're expanding access to screeners. Talk about mammography, colonoscopy, PSA for prostate cancer to ensure that detection occurs early when chances of survival are highest.
Yes, hepatitis and HPV are now being given on the routine immunization schedule of Nigeria. Every girl aged 9 is eligible to receive the HPV vaccine. Hepatitis from much earlier on. I've spoken about the screening. That is not available, and that is the part that we hope we'll be able to see more efforts put in, but both at the federal and at the state level. Even at the local government, they can do their own bit by putting in the screening agents that we need. We need sometimes even an ultrasound is okay. We can't advocate for every primary healthcare center to have a mammogram or every general hospital, but within reasonable distance, we should be able to provide that. Similarly, for the PSA, that's a blood test. It's quite easily done, and many people are offering it now. So there's no reason why at the age of 45, every Nigerian man should be eligible to have a PSA test. There are some relatively cheaper tests, but it's all about, being aware and planning and doing it at the right time. There are agencies, I think the military also tests for it. They do it for all their staff, employees, or everybody in there, but it's not universal, and it can be universal. We need it to be universal for us to screen and detect earlier.
I mean, hopefully we'll get there. But there is also always the issue of accessibility and affordability of these treatments. Professor Lipati had spoken to me about the establishment of catastrophic health fund to cater and to support rather cancer care. And according to him, it would prevent families from slipping into poverty due to costly treatments. This fund, according to him, would provide critical financial protection for Nigerians, particularly as cancer treatments are among the most financially devastating. But the last question I asked about that was how much work has gone into pushing this to the National Assembly. Catastrophic health funds to support cancer care. If this must work, Doctor, what advice do you have for the Ministry of Health?
For any fund to work, it needs a good governance structure. It needs to be evaluated. It needs the buy-in of all the stakeholders. You mentioned the National Assembly. Are they going to continue to sustain this fund? And then the governance structure, we throw money at things, and then how is it done? In 2 years' time, this one has gone, there's a new minister. In 4 years' time, there's a new governor, and things like that. So we need to have sustainability and continuity in our plans. It is possible. We have the right people in place right now. We have a fantastic Minister of Health. We have a fantastic Minister of Finance. We have a fantastic Minister of Budget. So let's do it. Why not?
All right. Well, winding down, but speaking of spreading healthcare centers across the country, isn't it possible to equip even primary healthcare centers with machines that can at least detect symptoms of cancer early in patients? I mean, this will reduce the threat of finding out late. Don't you think?
No, not all the machines. Like I said, within distance, if in one city we have within reasonable distance, say even for you to have one in every Yaba, Apapa, if I use Lagos, it's enough. That's enough. We don't need to have one in every primary healthcare center, but it depends on the distance. The biggest issue is how to get the people to the hospital and to that screening center. And if you can provide transportation for them, these are all dreams, but we need to work on them for it to work.
It's okay. Let's talk about your foundation. In terms of advocacy, how is your foundation collaborating with government or complementing efforts of government in the area of diagnosis and treatment of cancer?
Well, we do a lot in terms of awareness, in terms of diagnosis, like other foundations as well. But it's all very sporadic. We're not measuring the amount and the inputs or the impact that all this civil society like ours have. We get some funding, we come out, we screen 100 women, we screen 500 men for prostate cancer, and that's it. Our partners this year is not in their budget. We go around, and so that's the same story everywhere. It's not consistent, it's not sustainable. What is consistent is the awareness. We raise funds, we try to support cancer patients. We also work with the industry, pharmaceutical industry, to reduce the cost of cancer medication. The federal government has a similar scheme, but ours actually started before. And we, instead of, you get a huge discount over on top of what you would ordinarily pay for the cancer medication. So that's helpful. But again, a lot of high-level advocacy, working with policymakers and trying to improve the environment for cancer patients. It's not easy for foundations and civil society organizations. But I think we're doing okay. We're one of the luckier ones. We've been at it for over 15 years, like you said, 17 actually.
All right.
And we can see the difference.
All right then. Dr. Zainab Shinkafi Bagudu, President-elect Union for International Cancer Control, founder, CEO, Medicaid Cancer Foundation. Thank you so much for having this very important conversation with me. And hopefully we'll continue to make progress as a nation. Thank you so much for joining us.
Thank you for focusing on the day and for doing your own bit as well. I appreciate it.
Thank you very much. And thank you so much for watching, everyone. That marks the end of today's episode of Politics Tonight. But you can watch the repeat broadcast of this episode at midnight. Get in touch with us on our social media handles, Facebook, Instagram, and X at TVC News NG and at Olajumoke using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News Nigeria. I am Olajumoke Olatunji. Good night, everyone.